Hello everyone, my name is Reagan Bartel and I'm the Director of Health for the Métis Nation of Alberta. I'm also a proud Métis woman and a registered nurse. It's been several months now that the virus causing the infection known as COVID-19 began to creep into our province. Many of you will know someone who suffered from this virus, and many more of you will have been directly impacted from the restrictions that have been put in place. These public health measures have meant big changes in the way Métis Albertans live, work, and come together as community. I am so very proud and grateful for the collective efforts and the many sacrifices that Métis Albertans have taken in order to protect family, friends, and neighbors. Because of you and all Albertans, we're fighting back and flattening the curve. Alberta has announced their relaunch strategy. This is the next stage of our journey. Many of us, myself included, feel hope. As we begin to move into the gradual return to work and recreation, it's important to remember that the virus is not gone. We have worked hard and sacrificed much in order to create a barrier against the disease, and the result is impressive. The number of Albertans hospitalized and requiring intensive care is manageable. Our health system continues to remain intact. The early stages of this plan began on May 4th and included access to golfing, public parks, and resuming of non-urgent surgeries and access to allied health professionals like chiropractors and dentists. Stage 1 is slated to begin as early as May 14th, and this will see some retail businesses and facilities begin to open with public health measures still in place. The details of Alberta's relaunch strategy can be found online. Simply search for Opening Soon Alberta's Relaunch Strategy. To make sure that we don't lose ground that we've gained, it's really important that we use our common sense and manage our risks. Reopening does not mean a return to the way life was before pandemic was announced. Please continue to wash your hands and cover your cough. Stay home when you are sick and complete the online assessment tool to book a COVID test if you have any symptoms. Maintain a minimum of 2 meters away from each other and consider wearing a mask to protect those around you when you can't maintain that distance, such as when you're grocery shopping. Most importantly, please continue to stay socially connected. Look out for your friends and family as we work through the reopening of our province. On that note, it is Mental Health Week. I want to acknowledge that the public health measures put in place to keep us safe have really changed our daily lives. And for many, the stress related to the economic challenges or being separated from social supports has caused depression and anxiety to come to the fore. We know from talking to our community and from our health research that Métis Albertans experience challenges related to mental health and addictions prior to the pandemic, and many people find it really hard to talk about how they're feeling, and this makes it really hard for them to find the support that they need. Often, the hardest thing for someone who is experiencing mental health challenges is just reaching out. Our community has stated time and again that connections to community and culture strengthen our mental health. Kinship and community ties, part of our way of being, a protective factor and one worth celebrating. So instead of waiting for someone to reach out, I challenge you as Métis Albertans to reach out to your circles. Check in on your loved ones, friends, and neighbors. This little step can have a big impact. It can be something as simple as calling to share one of our online cultural activities, like Brianna Lazotte's kitchen parties or Métis Crossing's story times with Cookham. I know that we have youth in our community who have committed to talking about mental health and are working hard to make the stigma associated with mental health extinct. And as camp nurse Huckleberry, for a lot of those amazing youth, I am challenging them specifically to reach out and support each other and those around them. I am so very lucky to have a great support system to lift me up as I work my way through all the challenges related to this pandemic. There are others that don't feel so fortunate, but please know that there are options for support. The mental health helpline, the addiction helpline, the kids help phone have all increased their capacity to take calls. 211 Alberta, who has a partnership with the Métis Nation of Alberta, has also expanded to help community members make valuable connections to community supports. The Indigenous Hope for Wellness line is staffed by those who support residential school survivors, 60 Scoop survivors, and those impacted by the missing and murdered Indigenous women and girls, and is available in English, French, and Cree. Their trauma-informed approach is second to none, and these services are all free. If you are in crisis or you're having thoughts of harming yourself, please call 911. We care and we want you to be safe. You can contact the Métis Nation of Alberta Supports and Services Navigator at 780-455-2200 to obtain any of the numbers for the services I've listed. They're also available on the MNA Facebook page and have been circulated in MNA emails. Alternatively, you can Google them online. It's normal to feel anxious, afraid, angry, or even depressed. This pandemic has asked so much of us as individuals and community. It is absolutely okay if you are not fine. Just remember, you're not alone. Community and kinship ties, right? That includes stepping up as an individual and as a community to look after each other's mental health. This is part of our new normal, just like hand washing and physical distancing. I am so hopeful for the future. Our community has so many strengths, and we will make it to the other side because we are strong, we are a community, and we are Métis. Thank you.